The importance of a greener healthcare system from Jordan Spencer, everyone.
Thank you. Yeah, that was my intro. Hi, I'm Jordan, a physiotherapy student here at Saxion with interests in sustainable healthcare, which is what I'm going to talk to you about today. First of all, is there actually a need for the healthcare sector to care about sustainability? And what would that need be? What does it look like and why? Well, let's take a look. This is Maria. Maria is a spatial artist from here in the Netherlands, and she underwent a breast reconstruction surgery after having breast cancer. Now, Maria wanted to document the amount of waste that came from one surgery. This is from her surgery. In her video, Maria talks a little bit about the scissors, specialized stainless steel scissors that are actually shipped all the way over from Japan, used for one incision and then thrown out. Is there another way? Well, it's not just waste that the healthcare sector actually produces. In the UK Health Service, the NHS, actually contributes directly to about 5% of the emissions of the UK. And if you take, for example, indirect methods, such as the production of pharmaceutical products, the transportation of staff and patients to and from hospitals, this actually this significantly increases. In the US, the US healthcare system is strongly linked to the industrial sector. And what we've actually found, studies have shown that about 12% of acid rain that actually kills entire rainforests, is responsible, the healthcare sector is responsible for. Additionally, around about 1 to 2% of carcinogenic air toxins that cause cancer, and about 10% of greenhouse gases, among other things. So I think that we do have a role to play. But you might be thinking, okay, but the healthcare sector is there to save lives. Why does it matter? Well, the climate crisis is a health crisis. We can see that most evidently in COPD. COPD is a respiratory disorder, a disorder of the lungs. And one of the highest causes, or the biggest causes of COPD, is air pollution. So if the healthcare sector is contributing to the high climate crisis, and the climate crisis is contributing to poorer health, then I think we do have a responsibility to make things better. So how do we do that? Well, you can't change what you don't understand. Around about a year ago, I became a member of the Environmental Physiotherapy Association, where I met my mentor, Philip Marek, a PhD, who created the organization. And quite recently, he and some peers published a paper where they discussed the term environmental reasoning. So what is environmental reasoning, and why might it be important in healthcare? Well, we already have something called clinical reasoning. Clinical reasoning is when you make a decision for a patient, or with a patient rather, based on their values, so their beliefs, their needs, based on the clinical data that you have available, so measurements, your expertise, and based on research as well. You come to the best possible treatment intervention for a patient. Now, if we look at the research evidence, what we actually find is that there is a ton of research out there for these interventions about how effective they are. So how good they are at making a patient better. But there is no research out there at all about the impact that they have on the environment. So you can't change what you don't understand. If we don't know the impact that our treatments are having, then we don't know the impact. We're not able to make viable choices. So environmental reasoning calls for looking into that, getting that information and getting that research so that clinicians, physiotherapists, doctors, occupational therapists can make good decisions, not just based on the patient's best interest, but also the interests of the world. So I went along with that, with environmental reasoning. I wanted to go ahead and see for my project if I could actually do some environmental reasoning of my own. And I took a pretty common thing that we see as physiotherapists, an ACL tear or an ACL rupture. This is when a ligament in the knee breaks and it creates some instability. It's quite common in athletes. Some people might already know it already, may have even had one. And it's a very, very intensive rehabilitation. It can take upwards of years to rehabilitate fully from an ACL rupture. Now, there are two methods of treatment widely used, and the most common is the operative method. This involves having an operation, taking it a little bit out of a different muscle and inserted it into the knee in order to create some stability. And after the operation, you still have to go ahead and do a rehabilitation. You have to see a physiotherapist and you have to continue working. Again, it can take upwards of years. The other method is the conservative method. This skips the operation and goes straight to physiotherapy. Now, as I mentioned, there's no actual research out there about the environmental impact of either of these treatments. However, what we do know is that there is no difference, no significant difference or little evidence to show that the operation is any better than the conservative. In 661 patients, a study showed that 70% of them patients that went with the conservative method created stability and did not need an operation even 10 years after. So we can actually reduce the amount of operations by around 50 to 70%. In the Netherlands, there are 7,000 of these operations every single year. That's 7,000 times the amount of waste from Maria's video for an operation that hasn't necessarily been proven any better than just physiotherapy alone. In the US, 100,000 operations each year. That is 100,000 times the amount of waste from Maria's video for an operation that is no better than physiotherapy alone. But as physiotherapists, it's not our role to say what the patient gets as a treatment. It is largely down to the patient and largely down to the doctor about what they want. So what does that mean for me? Okay, I had to take a look then at the conservative route. So when assessing environmental reasoning, we can look at the different treatments that we use in physiotherapy. Now, we already know that being outdoors is really, really good for mental health, but it's actually significantly better for your physical health as well. Physiotherapists use a lot of these things: TheraBands, elastic, and there's not really much need for them. So I think a better option would be getting outdoors, walking on the stairs, doing some bodyweight exercises and some squats. We also use a lot of ultrasound in order to create some heat, something that we're taught here in school, even though a lot of research has proven it no better than massage or any sort of thing for improving scar tissue and improving the muscle soreness. We use a lot of treadmills. We run indoors. Why do we do that when we have beautiful, beautiful landscapes, beautiful roads paved for us, paths beaten down over time in which we could run on? So this is just an introduction to environmental reasoning. It's a call for healthcare providers to just take another look at what treatments you are using. I don't have any data yet, but I hope to one day soon be able to study some of these methods and show the difference between, or the importance of choosing between different interventions for a patient and using environmental reasoning within physiotherapy or within the healthcare sector. So I just want to tell you a little bit about some of the initiatives that are out there. I'm not the only person working on this, of course. Like I say, I already mentioned the Environmental Physiotherapy Association, a great association to get involved with if you are a physio, allied health professional, podiatrist, anything like that. Connecting people all around the world that are trying to encourage more sustainable practice within healthcare, encourage people to get outdoors, because typically as well, the better you are in your health, the less likely you are to have problems down the line. There are also some other amazing initiatives. The Eco-Medics, a group of GPs in the UK, trying to push the NHS towards net zero or further. NHS is also working very well with the Sustainable Development Goals, creating a Sustainable Development Task Force. And in a lot of situations, surgeries are necessary. I give you one example, but of course we know that surgeries save lives. However, there are actually projects out there that are working to make surgery more sustainable, such as the Green Anesthesia and Sustainability Project, working to make sure that operating rooms are shut down correctly at night so there is no excess consumption that is not needed, working to make sure that anaesthetic is greener and more sustainably produced. So a lot of great initiatives out there, of course. Thank you for listening to me today. In the words of the great Greta Thunberg, though, Sustainable Development Goals, blah, blah, blah. Net zero NHS, blah, blah, blah. None of this means nothing. These are just words without action. So we need action today. Go out there, learn as much as you can, try and do the research, and choose some environmental reasoning. And get out there in nature and have some fun.
Okay. I don't know if any of you still have questions, maybe?
Yep. Hi.
What can you do as a patient, so to say, to make more sustainable decisions in the care that you get?
Yeah, great question. I think just being aware, again, this comes down to awareness of the physio, but also the doctor and the patient, of course. And I think as a patient, you have such a huge role in your rehabilitation. They teach here patient-centered care. And essentially that's coming, I mentioned the clinical reasoning is largely based on the patient's beliefs, so the patient's wants. You can't force a patient to do anything because you've got to go based on what they want to do. So if you choose the sustainable option, then we are happy to give that, especially the ones that are the physiotherapists that are more into this side of thing. But of course it is our job to also motivate that and such. Yeah, I hope that answers your question.
You say that 60% to 60% of the surgeries were not necessarily better than conservative treatment?
Yeah, there's been many studies done on this, but there was one specific trial which followed 661 patients that went with the conservative method, and over that time, it's funny, they reported it, 30% needed a surgery within 10 years, but if you change that around, it's 70% didn't.
And then, do they say anything about the benefits or maybe also the complications to postpone the surgery? Because that might be very important for the patient to choose to risk prolonging the choice for actual surgery or not.
Yeah, so I did forget to mention actually that it's also, there's a lot of studies done on this in regards to the essentially you have early surgery versus the conservative method with the option of later surgery. And it doesn't necessarily make much of a difference apart from, of course, to the patient's quality of life for a little bit longer. However, they've also shown this to be not cost effective in terms of the actual quality of life improvements that are made over time. And what you also find is that with the people that are more likely to require surgery at a later date, there are actually prediction factors. So we know that if someone doesn't only have an ACL tear, but also has something with the meniscus, another part of the knee, then they're actually able to predict better that they will need a surgery later on. So I think, I'm not saying that the surgery is never needed and early surgery is not ever needed. I think it definitely is, but we can do better at predicting when.
Thank you for your answer.
Yeah, I have a question. I am worried that it's a bit off topic, but I was wondering, the surgeries in the hospitals, there's a lot of background players as well that, for example, the social security or the insurances and all that play a role in that as well. So they might be pushing maybe rather in that direction to spend money, earn the money. So wouldn't there also have to be done something in that regard?
I think
What could be done?
I understand. I think inevitably insurance companies do want to spend less, this is actually another potential problem for the conservative treatment. Definitely, of course. But I think if the research is out there, insurance companies have to go along with the research, and that's why making the call for environmental reasoning for these things to be assessed, the actual impact, I think it will make a difference. I think it's a long journey, and I especially in places like the US where it's very privatized and you do have a lot of potential issues with the insurance systems, then I think it's definitely an uphill path. But I hope with knowledge, with talking about this, with a more environmental reasoning, we can potentially push through that.
This might be a bit of a silly question, but are there like healthcare facilities where they started using like reusable masks and gloves where they can like wash them? I know this like takes away from water, but I guess it could help with the pollution of the discharge of it.
Yeah, well, this is also a huge problem and something that I didn't speak about today, but of course you have a lot of the gloves and the masks that are being thrown away during the midst of this pandemic. Even here at Saxion, you have the amount of masks that we have to use as in AGZ, the Health Academy. We have to, they give them as we have to put gloves on to touch one another when we're not even working with people with infectious disease or anything like that. And there's a lot of debate about it at the moment, whether students even need them. But yes, in answer to your question, I mentioned the eco-medics. They are working really, really well with the NHS for masks are never going to be completely sustainable, but they're at least creating these products that can have like upwards of 40 uses before they have to be thrown away, and the material then is obviously incinerated, so it's not always the best option, but for infectious diseases, for working in healthcare, you do need to take certain precautions, of course. But yeah, there's a lot of initiatives out there working towards it.